My name is Kelly Watkinson and I will be discussing the role of the nurse during the perioperative timeout phase. As the nurse in the operating theatre, it is crucial to ensure that the timeout procedure is followed appropriately. Human error can and does occur and patients can undergo incorrect procedures. The timeout allows all members of the operating team to collaboratively minimise error and ensure that the patient is as safe as possible when undergoing surgery. According to Shulman Hearing, a surgical timeout is the performance of a deliberate pause in patient care activities immediately prior to the initial incision, with the purpose of systematically verifying that the essential conditions for patient safety have been met. The timeout phase is the third of 3 procedures in the World Health Organization's surgical safety checklist, following the sign-in phase, which is performed prior to anesthesia, and preceding the sign-out phase, which is completed before the patient leaves the operating room. Shulman Hearing state that the nurse's primary responsibilities in regards to the timeout process include coordinating the timeout, generally performed by the circulating nurse, verifying that appropriate staff members are present, and documenting details of the timeout, including when it occurred and exactly what information was verified. The surgical timeout consists of the nurse reading aloud the name of the patient, the planned surgical procedure and operative sites, and any pertinent allergies. Along with this, the WHO guidelines also requires the confirmation of all team members in their role, regardless of if they know each other, whether or not any prophylactic antibiotics were given in the previous 60 minutes, and whether or not any essential imaging has been displayed. The nurse needs to ask the surgeon to verbally state the anticipated length of the procedure according to the patient's history and risk factors, the anticipated blood loss, and any critical steps that may be performed within the procedure. They need to request the anaesthetist also verbally state any patient-specific concerns and the scrub nurse or technician to confirm that all surgical equipment has been appropriately prepared. For the protection of the patient and members of the surgical team, any discrepancies identified during the timeout must be resolved before proceeding, along with ensuring at least 2 patient identifiers are used to confirm their identity. When the timeout has been completed and discrepancies have been resolved, the team can proceed with the surgical procedure. Performing a surgical timeout is important in reducing the risk for making preventable errors during surgery, such as performing surgery on the wrong patient, performing surgery at the wrong site, and performing the wrong procedure, along with lack of preparedness for the surgical procedure, therefore creating prolonged anesthesia time, and lack of preparedness resulting in delayed response to an emergency situation. As a timeout is the last safety check before a surgical or invasive procedure begins, protocol requires all team members to be fully engaged during the timeout in order to identify potential errors. MD McKee states that if you are not fully engaged, that means you are distracted by another task or thought, making you more prone to errors that could be costly for your patient, as any small misstep has the potential to harm or even kill a patient. The desired outcome from completing the timeout phase is to improve communication amongst OR staff members, whilst also protecting the safety of the patient throughout surgery. By performing this systematic verification of essential information in regards to the patient and their specific surgery, unwanted adverse effects and mistakes can be prevented in the surgical environment. Thank you for watching.